this one. Very confident.
Did he really? Let's watch that again.
Very confident.
There is no way that is real. Although it is possible that that type of thing can happen, but not from a slap like that. This beautiful young influencer, Brooke Monk, had a ton of comments basically stating that her breasts were far apart. So a couple things here. As a plastic surgeon who does a lot of breast surgery, she does not have breasts that are far apart. It is very natural to have a space between your breasts. And this is different for every person. There's some people where they develop and their breasts are very close together in the middle. In other people, they develop and their breasts are a bit farther apart. All of this is normal. Now, sometimes if you get breast implants, that can actually make that space look farther apart depending on how the surgery is performed and whether the implants are placed above or under the muscle. There is no operation that can take breasts that are naturally spaced apart and have a gap between them and make them smack dab right next to each other. The only way to really do that would be to obliterate the natural anatomy using implants and surgery, and really that's just not done unless it's a really bad plastic surgeon.
Wash your face with Head and Shoulders? You want me to wash my face with Head and Shoulders shampoo? Apparently, I have fungal acne, going like all around my face too. So everyone's telling me to use Head and Shoulders as a face wash. Head and Shoulders is antifungal, so it helps fungal acne. You guys, it worked! Look at my skin! She's healing. I cannot believe that this actually worked. Head and Shoulders cleared my skin in 3 days.
So is this something that you should try? Well, only if you have real fungal acne. Fungal acne is technically not acne like you may think it is. It doesn't create pimples. It doesn't cause breakouts that most of us who have acne have. Fungal acne is more of a folliculitis due to a type of fungus. And yes, this type of fungus is the same type of fungus that can create dandruff in your scalp. So it's true that Head and Shoulders can treat that type of fungal acne, but technically, once again, it's not like the acne that you're used to. Now, fungal acne typically presents as tiny little bumps that are often itchy. Once again, not sounding like pimples and normal acne breakouts. So if this is something that you think you have, my recommendation would be to see a dermatologist and get that confirmed. If, however, you have true acne, then Head and Shoulders is definitely not a solution for you. For situations like that, you want to consider salicylic acid washes, retinol creams, cleaning up your diet, taking a probiotic, and once again, seeing your local dermatologist. So cupping is a very established holistic practice to help people to recover from, let's say, injuries or if you have a really hard workout. To my knowledge, there's no scientific evidence to show that it actually does help with that, but there is a ton of anecdotal stories of people who find that it helps them. That being said, cupping every square inch of your body like this guy is doing, it's just bizarre, and I think that they're probably doing this as a way to attract attention and get views. And unfortunately, it worked because I downloaded it and we put it on this reaction video.
Okay, we're going to cut a cord because your placenta is trying to come, okay?
Is the cord white?
Well, it's its normal color.
I want to wait until it's white to cut it.
This is called delayed cord clamping. Typically when you have a baby, you have to clamp and cut the umbilical cord at some point. And there has been a relatively more recent trend to delay clamping the cord anywhere from a minute to even up to 5 minutes in some cases. The belief is that by delaying the cord clamping, you can get more nutrients, potentially more blood, and more antibodies into the baby that otherwise would be lost in the placenta. There are some reports, however, that if you do this, in the wrong baby, that could increase the risk of jaundice. So the important thing is to discuss a plan like this with your midwife or your obstetrician so that you can make plans and so you can do the best for your baby. If your baby is healthy, then in general, it's believed that delaying the cord clamping for a little bit could be a potentially good thing. If you have sensitive or mature skin and you want to reduce the appearance of fine lines and wrinkles, revitalize your skin, and support collagen synthesis, then you must try my Youn Beauty Peptide and Bakuchiol Moisturizer. It's fast becoming the go-to night cream for my followers and my patients. Check it out at younbeauty.com. There's a link in the caption below.
And now cough. Okay.
That is about the largest hernia I have ever seen, I swear, in my life. So what is a hernia? A hernia is basically a hole in the abdominal wall where what's on the inside can push out. That hole is commonly in the belly button in women who've had children. Sometimes you can get a tearing at the base of the belly button, and that can become a hernia where what's on the inside can essentially pooch out through an outie belly button. You can also get hernias in the groin area. That's very common in men, especially if you're doing a lot of weightlifting and stuff like that. And hernias can occur all throughout the abdominal wall as well, especially if you've had previous surgery. Now, this is a huge hernia, and so you got to wonder what is coming out through that big hole. That's probably his intestines that are basically pushed out through a large hole in his abdomen. Now it's actually protruding out into that hernia sac. The way that we treat hernias is surgical, where essentially we reduce or we put those abdominal contents back in the abdomen and then we close that hole up. Sometimes surgeons will put mesh over that closure, over that hernia repair, to help strengthen it to prevent that hernia from coming back. The good news is that most hernias, whether they're huge like in this case or even smaller, are typically paid for by your insurance company to basically close them up.
بصوا كده. اللي يعرف يا جماعة ايه ده يا ريت يقول لي بجد.
I have no idea what he just said, but that video is cap. There is no way he's got actually 2 irises on 1 eyeball. I call cap on that one. There is a trend online for people who have lost a lot of weight with Ozempic to be called lazy, to be told that they took a shortcut and that it's not the right way to lose weight. Honestly, as a physician, I will tell you, there is no necessarily right way for everybody to lose weight. And if you use some type of assistance, whether it is a medication like Ozempic or tirzepatide, semaglutide, any of those GLP-1 agonist medications, whether it is surgery like a gastric sleeve, or whether it's just old-fashioned diet and exercise, or even a weird type of a diet, be proud that you got yourself to where you are today. And if you're healthier by doing that, no matter how you lost the weight, then you should be celebrated. So don't listen to the haters. If you're on Ozempic and you've lost weight and somebody says that that's not the right way to do it, then they are not living in your shoes, and who cares what they think. So this is from some clinic outside the United States where apparently they are trying to suction her breasts larger. The issue I have with a device like this, number one, is it's probably not going to work. And number two is that the shape of that device, and we'll put a picture of it right here, you're taking a breast that ideally you want it to look kind of rounder in appearance, and it looks to me like you are trying to suck it longer. If you try to suck a breast longer, then it's going to look saggier afterwards. So it doesn't make a lot of sense to me. There is a commercially available way to do this with actual suction cups on your breasts, but this commercially available way, if you look at it, we'll put a picture of it right up here, it's called the Eve bra. You can see that the suction cups that you put on the breasts are shaped actually like what you probably want your breast to be shaped like. The problem with devices like this that will suction your breasts larger is that you have to wear them 10 hours a day for several months to get even a half a cup to a cup size difference. And if you miss just one day of those 10 hours, just one day, you get set back usually several weeks. So it's a very onerous, difficult process that yes, some women undergo to try to get a little more size to their breasts. Most people, honestly, if they really want to add size, they go with implants. And implants have a 97% satisfaction rate, but they also come with their own set of problems. And that is an entirely different video. So whenever I react to TikTok videos, I always end up by showing one of my videos.
Well, I could have, I really wasn't sure. It's coming.
Come on in, young Padawan.
I considered so many different specialties in medicine, starting with general surgery to family practice, and I ended up on plastic surgery, and honestly, it was one of the best decisions I've ever made. Well, these are some pretty fun TikToks to watch, but there are some pretty skibbity and insane TikToks that you've got to see me react to. Take a peek at this video right up here, and you will be pretty shocked at what some people are putting on TikTok and ones that actually go viral. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.